My name is Pamela. I'm going to talk about transcatheter aortic valve replacement. Definition. TAVR is a minimally invasive heart procedure to replace a thickened aortic valve that can fully open, like an aortic valve stenosis. The aortic valve is located between the left lower heart chamber, left ventricle, and the body's main artery. If the valve doesn't open correctly, blood flow from the heart to the body is reduced.
TAVR is a minimal invasive procedure, stands for transcatheter aortic valve replacement. Aortic stenosis is a disease of the aortic valve. The aortic valve is like the door of the heart, and when it becomes narrow, patients become symptomatic, meaning they have shortness of breath, chest pressure, sometimes they even pass out. So a TAVR is a procedure that can replace the traditional open heart surgery. So the procedure starts with numbing both groins. We put lidocaine under the skin, and that prevents the patient from having pain. The patient will be under light sedation, and we will insert catheters. Catheters are plastic tubes that allow us to inject contrast or advanced devices through them into the heart. We will then advance an aortic valve bioprosthesis. Currently at Tallahassee Memorial Healthcare, we have the two devices that are approved by the FDA to treat aortic stenosis. The Edwards valve is a balloon expandable valve. The valve is mounted on a balloon. So as a stent, you will put it in the position that you prefer and then inflate the balloon. That will expand the valve. Once expanded, the valve is already functioning. The Medtronic valve is contained within the catheter. The Medtronic valve is made of a material called nitinol. Nitinol is a material that has memory, so the valve is always wanting to be in their original position. We put it inside of the catheter, and once it's in position, we release it by removing the catheter. The valve deploys itself. By treating aortic stenosis with a TAVR, we are making patients live longer and better. That means no shortness of breath or chest pain or passing out while doing their regular activities or even exercise. The evidence has supported that the FDA has approved this therapy for people with intermediate risk for surgery.
Application. Somewhat similar to a stent placed in an artery, the TAVR approach delivers a fully collapsible replacement valve-to-valve side through a catheter. Once the new valve is expanded, push up the old valve lifts out of the way, and the tissue replacement valve takes over the job of regulating blood flow.
Transcatheter aortic valve replacement, or TAVR, is a less invasive catheter-based procedure. It is revolutionizing cardiac care and reducing the need for traditional open heart surgeries. It's a treatment for aortic valve stenosis. That's when the aortic valve in the heart functions poorly, usually due to calcification, reducing blood flow throughout the body.
We don't take out the valve in the patient. We just move the valve or the stuck leaflets out of the way without having to make a surgical incision at all.
A typical TAVR involves inserting a guide wire into the femoral artery and threading it through the aorta, then around the aortic arch and into the stenotic aortic valve and left ventricle. A common TAVR procedure involves delivering a new valve with a balloon catheter over that guide wire and into the stenotic valve. The balloon is then inflated, opening up the old valve and putting the new valve in place. The wire and catheter are then removed, leaving behind a new, functioning aortic valve. Here you can see the new valve opening and closing and able to restore normal blood flow.
The recovery for those patients, especially those patients that are older, is much faster. Most of our patients stay overnight and almost everyone goes home within 48 hours.
Cardiologists at UC Davis Health were the first in the Sacramento area to offer TAVR. They continue to lead the way in providing groundbreaking treatment options to patients with heart and vascular disease.
To have the opportunity to provide a minimally invasive procedure for those particular patients who need it is really life-changing for many of them.
Visit health.ucdavis.edu and search for TAVR, T-A-V-R, to learn more about TAVR at UC Davis.
Pros and cons. Pro. This procedure is fairly new and is FDA approved for people with symptomatic or high-risk patients for standard valve replacement surgery. Usually, valve replacement requires an open hair procedure with sternotomy, in which the chest is surgically separated. Open for the procedure, the TBR or TBI procedures can be done through very small openings that leave all chest bones in place. Cons. Complications involving the aorta, aorta dissection or perforation, aortic valvular complex, injury or rupture, or a left ventricle perforation have become very rare, but potentially catastrophic. In terms of durability of the implant prosthesis by physicians, the morphology of the prosthetic leaflet indices of valve stenosis and regurgitation should be evaluated with echocardiography. Issue applied in Ecuador. The head of clinical area and head of area of surgery of the cardiothoracic unit performed the valve replacement since 2015, where they implemented a new procedure, the transcatheter valve implant aortic stenosis for aortic stenosis. The device used for the transcatheter aortic valve implant is the core valve of Medtronic with diameters of 26, 29, and 31 millimeters, according to the size of the aortic rig. Here we can see the core valve, a core valve implant. Conclusion. In my opinion, at this time, the procedure is reserved for those people for whom an open heart procedure poses intermediate risk. For that reason, most people who have this procedure are their 70s or 80s and often have other medical conditions that make them a better candidate for this type of surgery. Thank you for attention.